Hello, I'm Ngozi Chidi Ebuka, co-chair of the AAO Innovations in Vision and Eyecare. It is my honor to be here with you today, and I'm thrilled to introduce one of the select companies chosen by the AAO Communications Committee to showcase their groundbreaking work in vision care. Each year, we see remarkable advances that push the boundaries of what's possible in eye care, and this year is no exception. We are excited to highlight a product that embodies innovation, dedication, and forward-thinking technology, RxSight. Please join me in welcoming Nick Bruns to share more about their incredible product and make sure to visit their booth at the exhibit hall.
Hi, I'm Nick Bruns. I practice in Milwaukee, Wisconsin, and I want to talk a little bit about some pretty cool technology that we've been fortunate enough to have in our practice for about 5 years now. So the light adjustable lens introduced in 2019 by RxSight has been a total game changer for us. Our practice in Milwaukee is heavy cataract and refractive, with a very healthy portion of our patients selecting premium IOLs. I'd argue that any patient that I see, there's really no such thing as a non-refractive surgery anymore. Patients come in with expectations. They've had friends who've had cataract surgery. Or they've had LASIK in the past. We had the LASIK boom about 20, 25 years ago. Those patients are now approaching cataract age, so they know what it's like to live without the burden of glasses or contact lenses. They come in with a level of expectation. Well, the light adjustable lens is so unique because it now gives us the ability, like the name says, to adjust the lens. We have the ability to adjust an IOL after it's been implanted completely non-invasively just using UV light. Sounds too good to be true, but I can attest that it is the real deal. So how does it work? Well, it's a three-piece silicone lens. Embedded in the silicone are UV activated macromers. So when we adjust the lens, what we're doing is applying a very specific wavelength of UV light onto the lens in a very particular pattern. The macromers that are exposed to the UV light bind together, and that creates a concentration gradient. So we are relying on properties of diffusion. So we have a portion of the lens that's got macromers that have polymerized. We have a portion where they're still free floating in the silicone. Those free floating macromers then migrate, right? Just like osmosis or diffusion, we've got a concentration gradient, so they're going to migrate. That migration causes the lens to swell and change shape. And so we can take advantage of those properties to manipulate this lens to match exactly what we need it to be to match a desired refractive outcome. So we do surgery just like any other cataract surgery. There's really not a lot of differences with the procedure itself. The real fun comes about 3 weeks after the procedure. We let the eyes calm down. The inflammation resolves. We keep them on their normal post-operative drop regimen, just like normal. Once the eye is calmed down and we get a stable refractive error or stable refraction, we can now measure where we're at and where we want to go. And that's when we get to start really having some fun, and we get to really customize these lenses to match a patient's lifestyle. So, it makes the whole process less hypothetical. With traditional methods, I'm forced to, as an optometrist working in a refractive practice, I've got to talk to patients about these options all the time. And it becomes kind of hard because patients are forced to think about what is life like without a cataract. They don't know. It's theoretical. It's hypothetical. They don't know what that's like yet. So you're really kind of forcing them to think into a situation where they're just not comfortable because they haven't lived with it. So you're kind of forced to make a decision, a best educated guess, if you will, and then deal with the consequences. If they don't like the lens, there's not really a good option except for maybe taking the lens out or maybe doing a PRK touch-up if you miss your mark. Now with the adjustable lens, that discussion comes after surgery. After the hard part. That's the part that's the most anxiety-inducing for patients, is the surgery itself. Of course it is. You're having eye surgery. We can get that out of the way, and now we get to counsel the patients on lifestyle analysis. How do you want to see? Do you want to see at a distance? Do you want to see up close? Do you want to have a little bit of both? Are you a very active person, or do you do a lot of reading? Why would I put the same lens in a 90-year-old who likes to knit as I would with a 55-year-old who's an avid golfer? Those two people have very different lives. They deserve very different customized options, and that's what the light adjustable lens can provide. So 3 weeks after surgery, we have a quiet, calm eye, a stable refractive error. We now can adjust the lens to match what that patient wants. And we can do that 3 times. So the analogy that I often use, it's like golfing. It's like golfing. So with traditional cataract surgery, we're pretty happy just getting that ball on the green. At least if you're as good of a golfer as I am. If you're not in the woods, that's a pretty good shot. I'd be pretty happy with it. We get the chance to putt it 3 times. And we're no longer satisfied with getting the lens or getting the ball on the green. We want to get that ball in the hole. And guess what? If you don't like where the hole is, you can just move it. That's the custom part about this. So we can get this to match exactly what you need it to be. It has been a total game changer for us. It has been the crown jewel of our practice for almost 5 years now, and it's been a total paradigm shift in cataract refractive surgery, something that you see much more common across the country now. Thanks for letting me chat.